Hello everyone, my name is Haider. In the previous lectures, we started a general series about the general anatomy, and we studied about the planes in which the body is divided, and we studied about the anatomical position and terms of position. Now we will see some other terms of position. If we see about the term dorsal and ventral, dorsal is actually towards the back, and it is also known as substitute of posterior. For example, superior surface of foot is called dorsal surface of foot. Dorsal means actually towards the back. Ventral, towards the belly. In Latin, venter means belly or abdomen, and ventral means towards the belly. It is also known as substitute of anterior. For example, if superior surface of tongue is called dorsal surface of it, then inferior surface of tongue will be called as ventral surface of it. In some organs or parts of body, we use superior as dorsal and inferior as ventral. And if we see about the term cranial, cranial is actually towards the head end. Another term is cephalic end or cranial end or head end, is used with almost similar meaning as cranial. For example, if we draw a fish, then we can say that this fish has a caudal end and a cephalic end. The head end is called as the cranial end or cephalic end. The tail end is known as caudal end or towards the tail. Same, opposite to the cranial is caudal. Caudal means towards the tail, commonly used in embryology because when you are 4 weeks old, you have a tail. So in embryonic terminologies, we use caudal of the fetus or caudal of the zygote, and at the 8th week in embryonic life, it disappears. Now we will see about terms of movement. Various joints of the body permit several varieties of movements, so the terms describing movements are also a necessary part of anatomic terminologies or anatomical nomenclature. For example, if we see a flexion. Generally, flexion is a bending movement in which the angle between two bones is decreased. It can also be known as the movement towards the ventral surface of body or the movement towards the anterior surface of the body. But angle not always decreases, because in the flexion of head, when we see the flexion of head, the angle between thoracic bones and the cranial bones is decreased. And same, if we do extension of head, there is the decreased angle between the thoracic bones and the bones of cranium. If we see about the extension, extension means straightening motion in which angle between the two bones is increased. Can also be the movement towards the dorsal surface of the body, or can also be known as the movement towards the back of the body, but the angle is not always decreased. So there is some difference in flexion and extension. If we see here, you can clearly see that this movement of arm is known as flexion. Here the angle is being decreased between the two bones, and if we straighten up the arm, this is known as extension of the arm, in which the angle between two bones is increased. This is flexion extension at elbow joint. This is flexion and extension at head. And if we see the flexion of hand and wrist joint and extension of hand and wrist joint, we can say that flexion is the forward movement of hand that decreases the angle between the hand bones and forearm bones. But contrary to the general definition, as we studied about the reference of angle, in the extension, it is the same. The extension of hand wrist joint, the angle between the bones of hand and bones of forearm again decreases. So here that definition fails. But flexion as extension according to the surface of the body, we can differentiate easily. That in flexion, it is the movement towards the anterior part of the body, and the extension is the movement towards the back of the body. And the flexion and extension of arm are known as special movements opposing to the definition that we have regarded. The flexion of arm is forward, upward, and medially, and the extension of arms is backward, upward, and laterally. So that was all about flexion and extension. We will see you in another lecture. I hope you like the videos and understand, so please do like, share, and subscribe. Thank you.